Laura is an advanced nurse practitioner with the Belfast Health and Social Care Trust. And in her role, she acts as a key worker for patients with lymphoma and has developed a nurse-led long-term follow-up clinic for patients with stable disease. Laura runs a systemic anti-cancer therapy clinic, a monthly holistic needs assessment clinic, and a 6-monthly health and well-being events for lymphoma patients. I think I need to sit down after that, and I will hand over to Laura. Thank you.
Hello everyone, my name is Laura, as we just a little fabulous introduction. A lot of that stuff I did in my previous role as lymphoma CNS, and I've kind of moved on now as an advanced nurse practitioner, but I have looked after many patients with CLL over the last several years. I am very much a nurse. I am not an expert. You are all the experts, okay? So I have put this talk together, and thank you for CLL Ireland and CLL Support for having me here, but I put this together with frequent questions that I have been asked over the years from patients. So it's very much been guided by everyone else. I'm going to talk a little bit about the psychological impact of being diagnosed. We've heard a lot of that today from Paul and Nikki and Jan. And talk about managing stress, ironically, as I'm standing here stressed, managing fatigue, activity levels, because I'm clearly just an absolute image of activity, practical issues, and getting the most of your appointments. So first things first, CLL, a diagnosis of CLL can take a great deal of emotional adjustment. It's a great toll on patients. You cannot underestimate the impact of living with these feelings that you have initially. They impact everything in your life. At the start, you're completely overloaded with information. We do have our own language in haematology, and my first several years as a haematology nurse, I think I had a little notebook with what all the words meant. Okay, so we do understand we have our own language, and we give you a lot of information. We give you written information, booklets, or even in COVID, like as Nikki was saying, over Zoom, which is not ideal. And then obviously you have Google and access to a lot of information. What's accurate, what's real, what's not. So it is very overwhelming. And it can be difficult explaining it to your family and friends. As Nikki said, he handed that over to a family member, and that is not the first time I've heard that. People respond very differently. You could feel very shocked, very numb. As Paul was saying, putting it in a box. Again, I've heard that over several years. And it can feel like it's happening to someone else, especially if it is maybe an incidental finding and you haven't presented completely unwell. It's common to feel a bit of grief as well. So it's grief about losing your good health, losing control over your life. Many people were going about their day, working, and suddenly you have these hospital appointments to attend to. And as Nikki was saying, it's quite frustrating to then have to take time out for a Zoom meeting. Well, what are we doing? What are we looking for? And I'll talk about the purpose of appointments later. You could feel a bit angry that it's happened to you. It might feel extremely unfair. A lot of the time, we cannot tell you why this has happened, and not knowing why can be quite difficult. You could feel frustrated about the disruption in your life as well, and it can be scary. It can be very anxiety-provoking. Whether you need treatment straight away is quite terrifying. Will you need treatment in the future? The active monitoring or the watch and worry, as Sarah was talking about. And we do have a quite proportion of patients that become depressed as well. And depression does not mean that you're not able to cope. It's a normal human reaction to anything that's happening. And you can't just shake it off. It's also another illness that you have to manage and can be treated. And it can be a relief to know for some patients what's wrong, maybe after weeks or months of being tired or having all these infections, or, maybe like the bruising, bleeding, all the symptoms that Sarah was talking about. But it can be very challenging talking about your feelings when you're told you have CLL. And some people might feel guilt as well. We've had quite a few patients say they feel guilty that they're suddenly needing all these hospital appointments if maybe they have someone else unwell in the family, or just the impact on their family and carers as well. And so it's important to chat through those with someone's support, and I'll talk through that in a wee minute or two. So there is a lot of new medical terms to get to grip with. As I say, it's a very complex disorder. It can be broken down quite simply, but when you get into the back of it and you get your information booklets and you get all the genetics and reasons why we choose different treatments, it can be very complicated. And say, why is it happening to you? Majority of the time, we will never know. We will not be able to tell you. And the why me can be very difficult for patients as well. I get frequently asked, is it something I've done? Is it something I didn't do? Gosh, I stopped going to the gym when I was 20. Is it something I've done? Have I eaten the wrong things? Have I done the wrong things? Have I been exposed to something? And the majority of the time, we cannot tell you why this has happened. All the investigations and blood tests. A lot of people, when they come to us, are not used to constant blood tests, constant investigations, maybe have never had a CT scan before, and that can be quite difficult as well. Information overload, I've already touched on. Treatment and no treatment. Sarah has already talked about the difficulties of not receiving treatment, and I'll talk about that a little later as well. And then if you do have treatment, will it stay in remission and how long? So you can see there's an awful lot of uncertainty a lot of the times when patients are diagnosed, and it's learning how to manage that as well. So we talked about our active monitoring and watch and wait, or Sarah called it watch and worry. That is a term we have heard an awful lot over the years, and completely understandable. Not having treatment goes completely against what people expect of having cancer. It's hard to explain to other people, well, I've got diagnosed with this leukemia, oh my goodness, what's happening? Oh, well, they're just watching it. That is very, very difficult to explain to other people. And it can make you worry constantly about whether your CLL is getting worse. Especially at the very beginning, if the white cell count is very low, we're maybe only seeing you, we'll say we'll phone and see you in 6 months, a year. And that time period in the middle, well, what's happening then? Do I need blood tests in the middle? How do you know it's not progressing? And sometimes people don't understand that it's not they're being treated. I had a couple of patients wrongly take it on board that they think that it's too late to be treated or they're too old. So we have to be really good with our communication and explaining what active monitoring is and why we do it. And so that's a really, really big source of anxiety for patients as well. So it's important to remember, I know we've had some stories today of things progressing very quickly, but the majority of patients, it usually is very slow. And as Sarah says, there's a lot of time usually to talk about what treatments are right for you. And it gives us a chance to talk about what will work from the genetics, etc., for your treatment as well. And it's about understanding that we, at present, unless Sarah doesn't magic, cannot cure this, but it can be managed over many, many years as well. Most people live with the CLL or SLL for many years and have long periods of time where they don't need treatment and when they don't. And I say, we're talking about the peaks and troughs as well. Whenever I was first learning about CLL, when I came in as a little baby lymphoma nurse, it was quite hard to understand, well, why do some people need treatment, some people don't, what are the numbers? It felt like the majority of people I saw in the treatment unit needed treatment, but then when I went on and was doing a lot of reviews, there were a huge number of patients that didn't need treatment. And so the general consensus is that 1 in 3 people will roughly need treatment around the time of their diagnosis. By the time they present, their disease is more active. And then another 1 in 3 people at some point in the future may need treatment. And then another third will never need treatment. And we can't tell you which group of those you will fall into, except for those who are diagnosed at the very beginning and we know they need treatment. And that's the purpose of active monitoring. And I'll talk about follow-up and active monitoring a little bit in the future. The knowledge of getting a diagnosis, it does give us some control over our lives and give us a sense of security. Some patients who maybe never need treatment, who are watch and wait for a long period of time, I've heard comments like, well, I kind of wish I'd never known because now I have this anxiety and now I'm getting these blood tests and maybe it would have been better if I hadn't known, or maybe it would have been better, But knowing our bodies does give us a sense of security. It's natural to want to know what's going to happen to us in the future, and I think sometimes as clinicians it's quite hard to say, well, actually we don't know. But it's about building up the rapport and making sure we're there for you the whole way through. But it does cause a lot of uncertainty whether you're receiving treatment or not. And you can't control what's going on with your health a lot of the time, but a lot of patients find it is valuable to think about what they can control, and that helps manage that psychological distress. So other aspects of your life that are causing stress and making changes. Perhaps you're doing too much work at home. Can you delegate everything else out or spread the load? Maybe your finances are worrying you. That's the last thing you need whenever you're also attending hospital appointments. And you help looking after children, parents, etc. And there's an awful lot of support available in the hospital and with CLL, Ireland CLL support online, with talking through this. Macmillan CAB, Citizen Advice Bureau, so things like if you have financial concerns, you can contact them. Do you need psychological support? So it's important to talk through these at your hospital appointments. And identify your sources of support, whether that as friends or family, whether it's your nurse specialist or like we have a haematology helpline that's 24 hours a day, CLL Support, CLL Ireland, they also have haematology support helplines. Lymphoma Action has a helpline as well. Some of our patients have real good support from their district nurse, their chaplain, Citizens Advice Bureau, other voluntary organisations, and it's important just to share that burden. Regaining control. You're all here today, which is wonderful, and people logging in online, which is brilliant, because the more you learn about your body, the more you learn about CLL, it makes it easier for you to understand what you need to be aware of, your symptoms, you know what's normal for you, you know there's changes happening, you know when to contact the hospital as well. And living well, keeping a healthy diet, stopping smoking, exercise, stress management, I'll briefly touch on each of these as well, can make it so if you ever need treatment, you're in a healthier position to be able to tolerate it. So what is cancer-related fatigue? This is one of the biggest things that patients will come to us about, is managing fatigue. It's maybe one of the things you're presented with, and it's not a normal tiredness. We go home at the end of the day and say we're tired. That's not the same as a cancer-related fatigue. It's an unusual and persistent tiredness. So it's very different to, I've worked hard all day, I feel exhausted, I'll feel better with rest. And it does interfere with normal functioning. So, as to say, you're talking about needing a nap at lunchtime. That is, I would love a nap at lunchtime, but I don't need it. You know, it's very, very different. You're unable to function throughout the day. Today might be a very, very long day for some of you, and that might also be difficult. So it's not relieved by rest or sleep. So generally when we go home, have a rest, we feel a little bit better. Whenever you have a cancer-related fatigue, it is different. There is that persistent lethargy underneath. And patients will talk about hitting a brick wall, that they just cannot do any more than what they kind of feel like they would like to. And it is subjective. We can't tell you what it is. You know yourself. And it's not particularly proportional to recent activity as well. You might have a good day today, but a bad day tomorrow. And it can make it difficult to even do small amounts of activity as well. And one of the biggest complaints is like that brain fog that comes with it. It's actually difficult to concentrate or make decisions as well. And there are lots of causes of the cancer-related fatigue. Obviously, the CLL itself. If you're undergoing treatment, that also causes fatigue. If you're sore, if you have other like aches and pains, that can add to it. If you're anemic, that obviously causes tiredness. If you have other medical problems, or if you are not quite as fit as some people, that also can add to it. Nutritional problems. Jan was saying how much great feedback they had from the dietitian. As well, trying to keep yourself fit, well, healthy, well nourished makes a big difference. Previously at health and wellbeing events, we've also had dietitians, and they are inundated with questions. Unfortunately, I think in the City Hospital we still have great access to dietitians, but I think there has been a bit of a drop in how easy they are to access due to funding, and that can be quite difficult as well. Any medications you're on can make you tired, and the actual anxiety, the emotional distress of being diagnosed, going through treatment, that can also cause like an emotional fatigue as well. And that's just basically a visual representation. We were talking about the peaks and troughs of your energy-wise, and that's psychological, emotional, physical as well. So what can you do to make yourself feel a little bit less tired? I don't have a magic cure. I'm not going to put up this one pill, I'm afraid, that you can take to make yourself less tired. So demand, managing your day-to-day activities, knowing what completely depletes you, what gives you more energy, and managing that day-to-day. The cancer and its treatment, you know if you are being treated, that you can have certain days where you're going to feel tireder, and trying to manage your day-to-day activities around treatment as well. And speaking to us about your side effects, speaking to us about how you're feeling, so that we can manage any side effects better, so that that is taken away from some of the fatigue, so we can able to manage that just that little bit better. And family and life role demands. We have a lot of patients that try and continue working full-time, doing 2 jobs, the whole way through being diagnosed. I know financially that's not always that's a decision you have to do. But as well, women taking on full roles, mother, caring. I had one poor lady who had 4 children, was looking after them full time. 2, I've seen nudges. And she also looking after 2 elderly parents, and she was exhausted. And it took a lot of going back and forth, chatting to her about, well, what can you do? Is there any additional help you can get into looking after your parents, children, etc., to take a little bit of burden off? And then managing the anxiety and stress, because anxiety and stress itself causes fatigue. And then what gives you a supply of energy? So sleeping well. I'm also not a person that generally sleeps well. So it's trying to get that sleep routine, and I'll talk a bit about that later as well. Activity and exercise can, I know is exhausting, but can give you more energy. Say good diet, good nutrition. Relaxation, doing fun things that you enjoy that will also distract you away from the CLL, and managing your stress. So sleep. One of the top tips, I know sometimes you're very, very tired and you need to sleep, but try not to sleep too much during the day. Limiting yourself to 1 short nap earlier in the day. Patients that maybe get particularly exhausted around tea time and then go to sleep, and then they're maybe up until like 1, 2 o'clock a.m. And trying to take regular light exercise and fresh air. In this country, it's not always easy. A lot of the time it is very wet, very rainy, but even just opening a window and a little bit of fresh air can make a bit of difference, rather than full fluorescent lights all the time, stuff your room. Trying to maintain a regular sleep routine, so going to bed a similar time each night. Avoiding caffeine and alcohol a couple of hours before bed. Reading, avoiding screens. Trying not to start new activities when you normally be going to sleep, so you're getting yourself in wind down mode. Having a warm bath with a little bit of lavender, a warm milky drink. I'm not quite at the Horlicks age, but you know, it does help. And if you do wake and can't get back to sleep, rather than tossing and turning, because at night time is whenever your brain ticks and all the what ifs, try and get up, listen to music for a little while, short period, read, and then go back to bed when you could feel tired, and learning relaxation techniques. And then why should I keep active? At this point, I'm talking to myself. So decreasing fatigue, it kind of goes against what you think. Decreasing fatigue, so if you're able to build up your activity levels, it actually helps you manage your fatigue. It increases your exercise capacity, increases muscle strength, can help with your mood, releases endorphins and serotonin, and then can help with your mood, your psychological well-being, and your self-esteem as well, and improve heart health. As a side effect, it can then increase energy, to kind of decrease any of that anxiety, depression, give you an improved quality of life, and improved sleep pattern as well. And this is also beneficial if you're ever to start treatment. The healthier you are, the more you've looked after yourself, it can help reduce some of the side effects as well. And then what can you do? So it doesn't have to be full joining the gym, you know, going on full runs, cycling to pretend, could not do any of that. I did try a brief marathon relay, and honestly, last year I thought I might die. So it is not for everybody. But simple walking, going for walks is brilliant for heart health, it's brilliant for exercise, it's brilliant for your brain. Jogging, as I did try that, was not for me, but some people, my knees couldn't take it. Some people really, really benefit from jogging. Cycling, swimming. The only thing I'd mention with swimming, cold water swimming is very, very popular at the minute. But obviously, it has been on the news, our seas are not always the cleanest, and there is a risk of infection, so just be mindful on that one. Resistance exercises such as weights. If you're going to do anything like that, it'd be important to speak to your healthcare provider first, just to make sure your blood counts are good. Okay, we don't want anybody at risk of bleeding or anything like that. And flexibility exercises. Recently had a talk from a physiotherapist who said that actually they are one of the best. Okay, so yoga, Pilates, yoga lattes, whatever's combined, are one of the best for generally building up your strength, core, keeping your weight down, heart healthy. I promised to join and I haven't yet. That's 4 months ago. But apparently it is really, really good for you. Dancing, whether that's in your kitchen or going out. Gardening, climbing the stairs regularly. Exercise DVDs, that's a bit out of date now. It should really be like YouTube, shouldn't it? That makes me feel a bit old. Or any type of games as well. So what's the goal? As I say, I've stolen a couple of these slides from one of our physiotherapists with her permission. So the goal is about 30 minutes per day. That doesn't mean 30 minutes of a jog. That could mean 10 minutes of a walk, and then 10 minutes doing a few, bit of stairs, 10 minutes hoovering or doing the gardening if you're able. And it needs to be moderate. So you're breathing slightly harder than usual, and you feel a bit warmer than usual. And the recommended amount is 3 to 5 days more than a week. But when do you not exercise? And this is usually most of the questions I would get phone calls about or asked about in clinic. So if we're talking to you and we're saying you're a bit more anemic or your platelets are a bit lower, it's not that you don't exercise, it's just to be very, very cautious because you could be tired or quicker. So it's about listening to your body. So we talked about having fevers or night sweats. That is not an ideal time to exercise either. If you have some dizziness or feeling unsteady gait, again, be very gentle about what you do. It's good to keep your muscles strong, but we don't want anyone risk of falls. If you're very breathless or you have side effects from other disorders such as nausea, sickness, or that irregular pulse we were talking about, that's times to be very careful and chat to your healthcare provider about it. And basically what we're saying is listen to your body. Stop exercising if you feel unwell, dizzy, or you develop anything such as dizziness, chest pain, difficulty breathing, or feeling sick, and just contact one of your medical professionals. So good to exercise, but do it safely. One of the things I'm going to talk about, some of the things we advise patients with CLL to do. So vaccinations is important. We've talked about how you can be prone to frequent infections, and it is important then to protect yourself against a lot of these infections going about, particularly like winter, cold flus months. So one of them, we recommend every year patients to get the flu vaccination, and every several years the pneumonia vaccination, and being vaccinated against COVID as well. Generally, patients, we talk about getting the shingles vaccine. All vaccines we talk about are dead vaccines. So people going on holidays, maybe far and abroad, talk about getting live vaccines. We don't advise that because of your immune system. And I know in the south of Ireland, it is different to the north. You don't have access to Shingrix, you were telling me recently, which is not ideal. Paid access, which is horrifying. Which is very different from the north. But yeah, we would generally advise to get vaccines where possible. But we know people don't generally have an extra €600 to get Shingrix, which is horrendous. Travel insurance is a big one as well. So we have had a lot of phone calls recently. It was probably before COVID, there was a couple of areas that were really, really good for patients who have had a cancer diagnosis. There seemed to be a group of travel insurance companies that took it in turns being sympathetic to patients with a cancer diagnosis and were very good at insuring. Since COVID, it seems to have been a little bit harder, and that seems to be more to the infection side of things, but it's still important to get travel insurance whenever you're going. Places like the Macmillan do usually keep a list of travel insurance companies that are sympathetic at the time. We've had a couple of patients who say, well, like, I'm not being treated for CLL, like I'm fine at the minute, or I'm in remission, I'm off treatment, I'm going to go on holiday. And then I've had infections when they're on holiday, and their insurance company have refused to pay because it's of their CLL. Even though they've maybe just generally got a cold, flu, cough because they've been on holiday. So it's just to be mindful of that. And then they've had to pay for things like chest x-rays in hospital. So it's just to be mindful of that. Care in the sun is a big one. And I think this is one of the things, especially since we live here, although we have had a few really nice weeks, that CLL is associated with an increased risk of developing skin cancers, particularly melanoma and non-melanoma. We'll talk about things such as basal cell carcinoma or squamous cell carcinoma. And it's probably due to the CLL's impact on your immune system. And so we will ask patients whenever they're in clinic if there are any lesions, as well as asking about lumps and bumps. So whenever you do go on holiday, or even whenever you're here, it's important to use factor 50, wear sun cream and wear hats. And I think that's probably not always a well-known side effect of CLL as well. And then obviously financial support. You may be able to go about your life as normal with CLL, or you may have to come out of work for a period of time for treatment, and there is financial support available. Talk to the Citizens Advice Bureau, your social worker as well can help. So I'll talk a bit about your outpatient appointments and the purpose of follow-up, whether you're being treated or not, and the perspective from our point of view and the perspective from your point of view. So the purpose of your follow-up appointments is to, if you're not being treated, is to monitor your condition during active surveillance or support your recovery post-treatment. It's to spot a progression in your CLL, a progression in your white cell count or your symptoms, or a recurrence if you're in remission. And it's an opportunity for you to ask questions and raise concerns. You could be seeing your consultant, a nurse specialist, or another junior doctor, and it can be very, very reassuring, but we do have a lot of patients who the night before do not sleep for the anxiety of what will my blood count show. So it can be extremely reassuring, getting to see your team, talking through your blood counts, any concerns, but can be very worrying as well. And it is a two-way process follow-up. It allows us, your medical team, to check on the progress of your recovery or your blood counts by carrying out our blood tests or any other tests we want to do. But it also gives you an opportunity to ask about your well-being, raise any concerns that you have related to your CLL and treatment, such as your finances or returning to work after treatment, immunisations or travel. If you have been treated, the end of treatment, especially those finite terms of treatment, can bring about a sense of uncertainty as well. Obviously, we're talking about you've been on treatment for a long period of time, and then the idea of stopping is a bit nerve-wracking. And you can feel anxious without the routine of hospital treatments. So whenever you're going through a period of treatment, you might be up to the hospital every couple of weeks, sick looking at us, Ray, yeah? But then suddenly we're saying, well, we don't need to see you for 3 months or 6 months, and that can be quite anxiety-provoking as well after regular attention at the hospital. So what do we look for at your hospital appointment? So obviously your blood counts, okay? And as Sarah has talked about, these B symptoms, which are more often typical of other signs of lymphoma, but can happen with CLL as well. And that's things such as drenching night sweats, weight loss, the recurrent infections or fatigue. We'll often ask you about lumps or bumps or lymph node swelling. We'll examine under your neck, around your neck, under your arms, and ask about shortness of breath or abdominal pain or swelling, bruising or bleeding. And that's just to look for all different maybe side effects of the disease progressing or something else. So we will have a discussion about your health. We'll most likely, unless it's a Zoom call, do a physical examination. See if your lymph nodes are swollen, check your tummy, make sure you don't have any lumps or bumps or any pain in your tummy. And Sarah's already talked about the lymphatic system, so I'll not touch on that again. If you are post-treatment, we will be talking about any side effects you have and how they can be managed. Your physical well-being, your energy levels, your emotional well-being, because a lot of the time whenever you are getting treatment, it's, well, there's your next dose of treatment, we're managing your CLL, and then suddenly you have time to psychologically think about treatment at the end. We also like to keep your GP up to date, so every time you come to an appointment, we send a letter to your GP. We'll tell them your blood counts, how we're managing you, how you're doing, any side effects, and when we'd like to see you again. And if you have had treatment, we'll also monitor for late effects. And late effects are health problems that can affect you months or years after you've stopped treatment. They could be like long-term side effects of your treatment or new problems caused about your treatment months or years afterwards. Not everybody develops late effects, but it's good for us to monitor them and be aware of a small proportion of people who may. And then your risk of developing late effects depends on a number of factors, whether you've had treatment, the type of treatment you've had, and thankfully that's been minimised now with a lot of the novel agents and less of the chemotherapy. But your risk of developing these late effects also depends on your lifestyle as well, and any other general conditions you have. And we also like to keep an eye out for relapse as well. So whenever you're coming to a hospital appointment, come prepared. Have a list of questions and concerns. As Nikki said, that first appointment he had over Zoom, he didn't ask any questions. He couldn't think about any questions to ask. I've also been on the other side of a doctor, someone talking to me, and I've just gone, okay. And then I've walked out, and about 2 hours later thought, I didn't ask that, and I didn't ask that, and I didn't ask that either. Oh, and I should have asked that. And then, as Nikki says, you Google, and then you sometimes get information like, oh my God, I shouldn't maybe Google that. So do come prepared. Any questions, concerns you have, we tend to tell patients, whether it's like the wee note on their phone or a notebook, jot down things as they come into your head coming up to appointments. Discuss the most important issues first. Unfortunately, we only have a finite amount of resources and time. We would love to spend hours with all of you and talk through everything, but it's not physically possible. So come what's important to you first. We know what we want to talk about whenever we come to a healthcare appointment. We want to know about any side effects, we want to know your blood counts, we want to know generally how you're doing, but that's not always what's important to you. So make sure you come to us with what's important as well. And sometimes bring a family member or a friend. Whenever you come out of an appointment, they did studies, and apparently you take in about 10% of what we say. It might be because of what we say, but the jargon we use, but also you only take in a certain amount, so it's good to have a second pair of ears as well. Tight in time, sorry, I'm going through, I'll whiz through. Keep a symptom diary as well, so that you know, well, you have good days, bad days. I said take something with you, and don't be afraid to ask for help or support. What's important to you is not what's important to us. It can be hard to navigate all the services that are available, and usually we keep a list of services that are available, charities, support, etc. And are we unclear? We often are with our jargon. Ask us to clarify. Don't do what Nikki and I have done. Will you walk out and go, what? You're not entirely sure? And then ask who to contact for further support and questions as well. And if you have any problems or notice new symptoms in between checkups, make sure you have details on who to contact. Nearly everybody should have a clinical nurse specialist, should have a helpline number, someone to contact between appointments. If you're not sure if it's something you should be aware of at all, just pick up the phone and ask us, and we can talk through these with you. So that's a bit of a quality. I'm not going to chat through this, but it's a quality of life model that's applied for cancer survivors. Okay, so what is important to us is not what's important to you. So a lot of patients focus on their physical well-being, the psychological well-being, spiritual and social well-being, and it's one big circle. And without all of these, you cannot live well. So it's important to chat through all of this. As I say, at the heart of the appointment is you. It's your life, your concerns, and your quality of life. And remember, all your concerns are valid, and don't be afraid to ask for help and support when it's available. Are there any positives? I've just talked about how difficult it all is. Some people find that going through emotional difficulties makes them feel a little bit more stronger and peace than ever before. Some people have described that a serious illness can be a good thing because they learn to appreciate things that are really important to them. A lot of patients have reevaluated their life. Things that previously stressed them out, they have maybe cut those out and said they feel a little bit stronger after it. Some people feel their illness is a challenge but find a strength that they didn't know they had as well. And some people find that inspires them to look after their health. You get a diagnosis previously, you were maybe having several glasses of wine at night and not going out for a walk, but it can inspire you to look after yourself, and it can also inspire you to share your stories to inspire others. So identifying your key contacts. I am coming to the end, I promise. Who can you call? So if we are only seeing you once every several months, and maybe because of COVID it is now often a telephone call, which as we know is extremely isolating, who can you contact in between times? Obviously there's CLL Support, CLL Ireland, Lymphoma Action or the Irish Cancer Society for cancer charity support, helpline. A lot of these charities do peer buddying as well, and we sometimes try and do buddying in our own area. So sometimes we have had patients that say, look, I'm have this diagnosis, I'm going through this treatment, can you buddy me up with someone else who is going through this as well? And we'll ask permission to share contacts. Make sure you have a contact for your nurse specialist to phone between appointments, or your hospital helpline as well. And I know we're eating into question time. I promise that's me done.